It's an honor to be here this morning. It's an honor to be invited to bring to you some information that I hope you'll find useful. Also to make the connection between how information technology can support the physicians and those that are providing care to patients. So we're delighted this morning to have a couple of other gentlemen here with us to present some information. So if you don't mind, I'd like to go ahead and invite them to the stage as well. First, I'd like to invite Amit Mukam, who's a partner of Advisory Services and a National Industrial Head for Healthcare at KPMG India. So welcome. Thank you. And then I'd also like to invite Karan Singh, who's the lead on the healthcare practice in Asia Pacific from Bain & Company. Thank you. So to kick off this morning's session, what I'd like to do is to bring to you some information that, again, I hope you find helpful and useful here in India. But I want to share with you some things that are going on outside or around the world with respect to information technology. So let me see if I can find my presentation here. Which folder is it in? So this particular session is going to be about analytics and the future of healthcare ICT. So what I want to do is sort of set the stage for you. The first thing I want to talk about, though, is HIMSS, the company that I represent. HIMSS is a global cause-based organization, and our focus, as you can see by the slide, our mission is to bring about better healthcare through the use of information technology. And one of the ways that we do that is through our HIMSS Analytics mission. We have a wholly owned subsidiary of HIMSS called HIMSS Analytics, and our mission is to, as you can see up on the screen, to provide the highest quality data and analytical expertise to support improved decision making for healthcare providers, health IT companies, as well as consulting firms. And one of the ways that we do that is through a capability maturity model that we developed back around 2004. And this maturity model is called the EMR adoption model. This adoption model basically serves as a roadmap for hospitals and healthcare organizations to follow to adopt information technology. There's 8 stages to the model, and at stage 0, it's basically the point where hospitals have little to no information technology that they're using to provide care to the organization. So in essence, they're virtually a paper-based organization. Everything they do is on paper. As they progress through the maturity, as they progress through adopting information technology, ultimately we expect that they'll achieve the highest level, which is stage 7 of the model. At stage 7, they have adopted advanced capabilities of information technology and have become virtually a paperless organization, where they don't document anything on paper, they don't write prescriptions on paper, everything is done electronically. So that is the EMR adoption model. This particular version here is for acute care hospitals. We also have a version for primary care or ambulatory clinics. I could spend some time going into the details of the model, but we don't have much time to do that this morning. But I wanted to let you know that there is a roadmap, there is a maturity model that can help you figure out which types of technologies and capabilities to help you get to the point where you have advanced capabilities that provide support to your caregivers. So why are we doing this? Well, first of all, through this model, we're able to collect data on hospitals throughout the world and ambulatory practices. In the United States, we collect this information on an annual basis. So every year, every hospital in the United States gives us information about the technology that they're using in the organization. And then we collect that into a database. We do the same outside of the United States as well in Asia, Europe, the Middle East. We're beginning to do that more in Latin America, where we're collecting data from the hospitals and we're adding the data to the database. Now, I showed you the model just a minute ago. Once we have the data, we then have an algorithm that we run the data through, and out as the result of that algorithm is a score, and the score tells us where on this maturity model the hospital or the ambulatory practice may sit. So for example, based on their data, they could get a score of 3, which tells us they're at stage 3. It also means that they haven't implemented the technologies that are, all of the technologies that are expected at stages 4 or higher. So why do we do this? There's 4 main reasons why we do this. The first one is for thought leadership. We want to be able to share the data back to the industry so that we can help drive quality, we can help drive safety and efficiency improvements in delivering health care. The other reason is because we want to help inform governments. Governments have been using our data to help them create and build or develop national policy for the adoption of information technology, as well as for the, in the United States, we call it meaningful use, to demonstrate how you're using information technology to meaningfully, and that you're using the technology in a meaningful way to deliver care. The other reason is to inform the market. So we want, like what I'm going to be showing you here this morning, is to be able to let you know where the market is, whether it's in India, whether it's in all of Asia or the United States, where the market is in terms of the adoption of information technology. So I'll show you some information about that here in just a minute. But that's another reason why we're collecting this information. And then we also want to be able to drive the market. So one thing that this information serves as is a motivator for organizations to begin to move quicker towards the adoption of advanced EMR capabilities. So the way this is done is because this is a maturity model and organizations are using it as a roadmap, as a strategy. I can tell you, I visit hospitals around the world, and I've been into many hospitals where they take this maturity model and they use this maturity model as a tool to inform the leadership of the hospital, to inform the boards of the hospital and the ambulatory organizations and the community that here is what we're going to be doing, here's what we're committed to doing to adopting information technology to provide better care for you. So I've seen this work as well. So you can see the 4 reasons why we do that. Now, I'm going to show you some statistics based on the data that we've collected in the United States. I have some other charts that I'll show you for other parts of the world. But in the United States, I wanted to share with you that of the 5,449 hospitals that we have, only about 3.1% of those today are at stage 7. So only about 175, 180 hospitals have achieved advanced EMR capabilities. And when I say advanced EMR capabilities, I'm talking about the ability of the system to provide clinical decision support to the physician. As they're documenting in the EMR, the system is giving them feedback. Here's a recommended protocol. Here's a recommended order set. Here's the recommended treatment for that disease that you've entered for that patient. So clinical decision support. It also provides, this level of capability means that the organization has some level of analytics capability. They are able to look at their clinical data and their financial data and any other business data, mash it all together, and then to use that to create metrics and to understand what's going on in their organization from all different angles. And then they can use that information to help them make specific decisions about how to respond to the issues and the concerns that they have in their particular communities. So a stage 7 organization has those types of capabilities, and I'll talk about that more in just a minute. But you can see where the hospitals fall within the other stages of the EMR adoption model. Now I've got 2 columns here. The first column, the second quarter of 2011. In the United States, when President Obama signed the American Recovery and Reinvestment Act in 2009, what they essentially did was make available $20 billion to the healthcare industry to say, if you will adopt information technology and demonstrate to us based on the metrics that we establish that you can use information technology in a meaningful way by improving care, reducing cost, improving outcomes, then we will give you extra money to help cover the cost of implementing that technology. So that law was signed going out until the second quarter of 2011. So in 2011, up to 2014, there's been a tremendous increase in the number of hospitals that have achieved stages 4, 5, and 6 of the EMR adoption model. So I'm saying that to let you know that, at least in the United States, they're motivated by money, right? So technology is not cheap in some cases, and a lot of the smaller organizations particularly needed help from a financial perspective to be able to implement the technology. So this was very helpful for them. So they were motivated by not only the extra money they were able to get, but also now that they're realizing that there are other values other than having the money, there's other values to having this level of capability, which is improved outcomes, improved care. And we have a lot of data that demonstrates the return on achieving this particular level. Now this is what the adoption looks like in Asia, in the Asia-Pacific region. So in the United States, the hospitals present their data to us on an annual basis. Outside of the United States, it's given to us when we're invited to come and collect the data from them. So we don't ask the hospitals, we don't go out and proactively solicit the data. We are being asked to come in and collect their data and tell them what their scores are. So far in Asia, we have 626 hospitals that have asked us to come in and collect their data. Some have been driven by the governments, so the ministries of health have asked us to come in and do this. Others, hospitals have asked us to do this on their own, but we've been able to collect over 600 hospitals worth of data, and you can see based on the data that we've collected that only about 0.2% of these hospitals have achieved stage 7 of the model. About 2.9% are at stage 6, and we still have roughly over half that are still providing care, documenting care on a paper system. So this is what Asia looks like. So with the data that we collect, we're able to show you not only from a region perspective like the United States or from Asia, we can also do a cross-country comparison. So on this particular slide, this is not all-inclusive. This is just a representative sample of the countries that we have collected data on. You can see, compare country by country, where these countries are, where those healthcare markets are in terms of their adoption of information technology. I don't have India up there, but we have collected some data for some Indian hospitals as well. We'd like to see more. So I'll give you a minute to look at that. I don't want you to spend too much time on the slide because, again, I just wanted to show you that the data that we have collected is global. We can do some global comparisons, but also to let you know that interest and the commitment to adopting information technology is a global is a global interest. So a lot of countries in the world are working towards this direction. We don't have any hospitals in Africa yet. But I am talking to an organization that is working very hard to provide EMR-type capabilities to particularly the really small villages in, around Lake Tanganyika, where there's 4 African countries that surround Lake Tanganyika. And a lot of the smaller villages there have, a single healthcare giver. They have no technology whatsoever, but the government is trying to collect data on their population so they can help provide better support for their population from a healthcare perspective. So this particular organization actually created a way to transmit electronically medical information on patients from the villages, some villages that don't even have roads that go to their town, be able to transmit that information back to the government so they can begin to collect data on diseases and what have you that is happening in Africa. So even in the continent of Africa, there is interest in using technology to help improve care for the population. So from a stage 6 and stage 7 perspective, I want to let you know that before we validate a hospital at stage 6 or stage 7, it's not an automatic thing. We actually will visit the hospital and we want to see the technology that's being used and confirm that, yes, they do have computerized practitioner order entry. Yes, they do have physicians documenting in the EMR. Yes, they are able to have lab systems and pharmacy systems support the EMR. So we physically go there, and these are the places that have been validated by us as having the stage 6 and stage 7 level capabilities. So right now at stage 7, there's only 4 countries outside of the United States, 5 if you count the United States, that have stage 7 organizations, and we're around 15 countries that are now at stage 6. And you'll notice that India is included in the stage 6 category as well. So congratulations there. Now, the summary of a stage 6 and stage 7 organization, this is where I want to drive home the point that I made yesterday, that it's not about the information technology. It's really about how we use the information technology to drive improvements in care, to drive improvements in performance in terms of the business, and to help reduce costs for healthcare delivery. So when you look at a stage 6 and stage 7 organization, here are the things that we expect to see when we visit those hospitals. So we expect to see that they're using data to drive improved outcomes related to their processes in the hospital, financial processes, their clinical processes, quality and safety. And we want to see metrics that they have been tracking in the hospital to prove that they have made these improvements. So it's not just a, you tell us and we say, okay, we want you to show us. So that's one of the characteristics of a stage 6 or stage 7 organization. As I mentioned earlier, they're virtually paperless. Nearly everything they do is electronically. It's not on paper. Everything that's clinically relevant that the physician needs to provide the best care possible to the patient is available right there in the EMR, so the physician doesn't have to log out of the EMR and go to a different system or pick up a paper record and look for information or try to find information out on the internet. Everything the physician needs in order to provide care to that patient is available to them in one place so that they can provide the best possible care. These organizations are also fully committed to continuous process improvement. So once you achieve stage 7, that's not the end, that's the beginning. So what you've basically done is established the foundation on which you're going to drive further future improvements in the organization. You've got the technology base in place, and now that you've got the technology base in place, we see this as the beginning to even greater improvements and better healthcare and better outcomes. They're fully committed to embracing their technology provider. So whoever your technology provider is, they're working side by side, hand in hand. They see the relationship as a partnership, working together to achieve these capabilities for the organization. So those are 4 characteristics that we look for in a stage 6 and stage 7 organization. Now, I talked about establishing the foundation with the technology, getting to stage 7 of the organization. Once you're at stage 7, once you have that capability, what's next? So that sort of gets to analytics of the future of ICT. So from an analytics perspective, what I'm sharing with you here is the strategy for one hospital that I thought was very well done, but it speaks volumes, I think, to the direction that we need to go from an analytics perspective. So what it talks about here is sort of the maturity of an organization as they learn to get access to the data that they've been collecting and turn that data into information and knowledge and into actionable activities from their analytics capabilities. So as organizations mature their analytics capabilities, they typically start at the very beginning with the question of what happened. So an organization that's very young in its analytics capabilities is really only focusing on looking at what happened in the past. So we've got all this data, and we can tell you that over the last couple of years our costs have gone up or our costs have gone down, chronic disease metrics have improved or gotten worse, but they're only looking at a retrospective perspective. So the next level in terms of analytics maturity gets to answering the question, why did it happen? So you're seeing that your costs are going up. So let's look at the data to find out why our costs are going up. What does the data tell us that we can learn from it to understand why the costs are going up? So that's sort of the next level of analytics capabilities. The next one is, okay, so what's happening now? So I can look back at what happened before, and then I can try to understand why it happened, but I want to know what's happening today. What are our physicians doing today? What are our nurses doing today? Are our patients compliant with their diabetes treatment today? So being able to have a real-time view into what's going on in the organization, what's going on with your patients. That's the next level of maturity in terms of being able to use the data that you have. And then the next level is being predictive. How can I predict, knowing what has happened before, knowing what my population looks like today, what's it going to look like 10 years from now, based on what we know today? So thinking about what it's going to look like 10 years from now, 5 years from now, you can then begin to make decisions about changing that outcome. If it doesn't look like a good outcome, then knowing what has been happening and why it's happening, you can now begin to make decisions. You can begin to adjust processes. You can begin to change your activities in the organization to try to prevent or improve the predictions that you're able to make as a result of your analytics maturity. So ultimately, what we're striving for is to get value out of the use of our information technology. We don't want to implement technology just for the sake of implementing technology. We want to get value back out of it. So using analytics is a way to help you do that. So that's really the takeaway for that particular slide. Now, what value is the data to prove it? So this is a repository of all of those case studies and stories. Right now there's about 8,000 from around the world, and these stories are broken down into these different areas. So for example, if an organization has data to prove that they've improved patient satisfaction or staff satisfaction, such as physician satisfaction or nurse satisfaction, then those stories will be in this area at the top under S for satisfaction, and the same for the other areas. So this is an online resource. It's actually on the HIMSS website. It's free. It doesn't cost anything. You can go and research it all day long, but there are specific case studies out there. If you're looking to try to figure out, okay, I kind of like the idea of computerized physician order entry, having physicians enter their orders online through a computer system. But I don't know if it's really worth the money or worth the effort to do that. You can go to this data repository and do a search on CPOE and be able to find stories that, and reports and case studies that will show you the value that other organizations have gotten out of adopting CPOE. This will then help you better make a decision for your organization to determine whether or not it's the right thing for you to do or not. So this is a resource to help you, help your organization decide what is the best type of technology or capabilities that your organization can implement. So that's what the website looks like. It is dynamic, so you can click on any of these colors here, and it shows you, it'll break it out by either more categories and even more categories until it finally gets you to the report that you're looking for. So it's a really great resource. We continue to add stories to this database regularly. The other thing too is that if you have adopted information technology in your organization and you can demonstrate an improvement in one of these areas, send us your story. We can add it to here, and the rest of the world can then benefit from the improvements that you've been able to garner from implementing information technology. So that's the foundation that I wanted to set for our discussion this morning. Hopefully it's helpful for you. What I'd like to do now is